Hi, my name is Dr. Jeffrey Riopelle from the Riopelle Cosmetic Surgery Center in San Ramon, California. And I'd like to talk to you about a very unique treatment that we do that not that many doctors in the United States do. It's fully FDA approved for use, and it's called the thread lift. This is the silhouette suture. The silhouette suture is the most recent advent in lifting of the skin and the most recent thread. We've had several threads over the years, but this I believe is the best by far that's come along. And it's a fairly small suture. You probably can't see it very well, but there's a needle followed by a small suture with little cogs. And these little cogs actually are for lifting and elevating the skin so that it can be pulled up and tied down. The great thing about the thread lift is that there are no sutures and no cutting in the face itself. We do a few little punches or a small incision up in the hairline where you can't see it, and then we actually run threads down to the areas that we're going to lift. So where can we lift? Well, we commonly lift the brows, the nasolabial folds, and the jowls, and sometimes the neck. How's the lifting done? Well, we take the little needle after numbing the skin with a numbing medication under local anesthetic and just in our regular office. We then pass the needle down and bring the needle out in the area that we want to lift. So suppose we want to lift the nasolabial folds. We're going to pass the needle and bring out the needle here, and then we cut off the needle, which leaves the cogs and the thread inside the skin. Then we run a second one down just below it, and then up top we will actually tie this down to the fascia. So we anchor it to the fascia because the fascia is very strong in the scalp area. And what that anchoring then does is it actually lifts the skin and causes tightening of the skin in the area that we're trying to lift. So it's a fairly quick procedure, has very minimal risk to it, and the results are very gratifying. It tends to last about 2 to 3 years. Now the other nice thing about it is if we want to raise the skin again 2 to 3 years out, we can simply find the area that we've sutured, open that up, and with a little local anesthetic, and actually lift that up again and anchor it down a little higher, which will re-lift the skin without putting in all new threads. These little protein cups are what are really unique about the silhouette suture, and they grab the undersurface of the skin and the fat and create the lifting so that we're not having to do any suturing down here. How does this contrast to, say, a facelift or the lifestyle lift? Well, the lifestyle lift is also a facelift, but it's not as aggressive a facelift. A facelift will dissect all the way down through here and cut out skin, so there are more incisions. Much longer recovery time from it, much more downtime, definitely significant time off work with a facelift, and also much more expensive. You can get much more lifting with a facelift, so if your skin is really loose, the facelift is the best option. But if it's mild to moderate tightening that you need, the silhouette suture or thread lift is an excellent option. What about the life enhancement lift, or rather the life lift? This is a lifting procedure that is a little mini facelift, the lifestyle lift it's called. This little lifestyle lift basically dissects only tissue from in here and does lifting. So it's very different than the thread lift. The thread lift is actually lifting down below. The advantage to lifting down below is that there tends to be less relaxation of the tissue with time as opposed to the lifestyle lift. Because when you're not dissecting, when you're not lifting way down here, when you're only lifting from this area, as with the lifestyle lift, if this skin stretches out, you're going to lose the lift. So that's why we prefer in our office to do the thread lift. And so we encourage you to come in, talk to us, review all the options. We can tell you all about the procedure, go over the pros and cons for you based on your individual skin type. And we also use this in combination with other procedures that we do. Our philosophy is to mix and match the best procedures, and in today's world where we can't afford a lot of downtime, we feel that the procedures that we offer for mild and moderate lifting are excellent ones for most individuals because they can be done and patients can go back to work fairly quickly.